Welcome back, friends. We're glad you're tuning in to the Ridgeview Pod. My name is Michael Yates, where we try to cover everything hope, healing, and recovery related. We have got a wonderful topic for this week's episode. Since this is September and it is National Suicide Prevention Month, it seems entirely fitting that we have Melissa Frye, our coordinator of Mobile Crisis Services, join us today. Good to see you, Melissa.
Thank you. Thank you for having me.
I'm glad you're here. So let's just start at the beginning. Tell us a little bit about Mobile Crisis Team. What does that do for folks?
Well, that's a good question. Mobile Crisis is a lot of times considered like something that's mobile and moving and out in the community, and that's not necessarily the case, although it is kind of what we're doing. So basically, Mobile Crisis is a state-funded program where we help people figure out what kind of mental health treatment that they actually need. Someone who is overwhelmed and confused and not sure how to get treatment, they can give us a call. We can get them like moving in the right direction.
And we'll have the number up periodically throughout this episode so folks know what that number is.
Yes.
If and it's for, this number is for adults only,
For
correct?
adults only, that's correct. Youth Villages works with children in our community, but Ridgeview works with all adults. It doesn't matter whether you have insurance or don't have insurance. If you call Mobile Crisis, we can help you and get you directed in the direction you need to go.
So if I'm experiencing a mental health emergency 24/7, I can call this number and someone's going to answer.
Yes.
And what happens at that point?
So basically, you're just talking to a person. It is a therapist who has been trained to help you manage your crisis. They will help you just talk through what's happening, identify ways that you can be safe and you can continue to be safe until we can get something more intensive to you, such as if you're just having panic attacks, and I say just like that's not important, but it is. If you're having panic attacks and feeling overwhelmed, we can talk with you and just talk through the whole situation and say, maybe you could do these things to help you to relax, and maybe provide some numbers for you to get services set up. If someone calls and they're having or considering harming themselves or maybe even completing suicide, we try to talk with them and help them, identify ways to stay safe, such as, having family members come over, involving someone that they feel safe with. If that can't happen, then we will have to intervene. If we can't come up with ways to help you stay safe, we will have to send police to you and an ambulance to you, maybe get you to the emergency room, and then we'll talk with you there to help you figure out what will help you best to, reduce those suicidal thoughts and feelings.
So you brought up the emergency room. So we have, you have telehealth connectivity with most emergency departments?
With all of our emergency departments, we can talk to you on the little screens. I call them Sheldons because everybody remembers the episode of Sheldon thinking he can, participate in the world by video. So it's just a little funny. We like to joke around a little bit, and we talk to you on the Sheldon so that, not everybody wants to be exposed to COVID and all of the things that are going around right now. In the past, we have gone into emergency rooms and into the community with law enforcement, but because of COVID right now, we're all restricted and we can't actually go into the community right now. But we will talk to you over the little computers, and it's all secure and all private, and everything is just protection for us for COVID, and maybe for you in case we've been exposed.
Right. No, that's important.
Absolutely.
So let's talk a little bit about medical necessity. So, one of the things that you're involved with doing is screening people to determine what type of care or level of care, treatment that they may need.
Right.
So you mentioned suicidal, homicidal. Walk me through, what does that look like in terms of meeting eligibility for, say, hospitalization?
Well, it looks different for different people. There's no absolute set way that we determine eligibility. What we have to determine is, can this individual keep themselves safe with family, with other support system, with outpatient mental health care? If they cannot be safe, whether it's due to having homicidal thoughts or suicidal thoughts, or even experiencing some sort of psychosis that leads to unsafe behavior, whether it be walking in the street or whatever the case may be, if that unsafe behavior is present, then we have to make sure that you're safe. And medical necessity is based on making sure the individual is safe and has the least restrictive services that they can get to keep them safe and keep them in their community. Our goal is to keep people in their community. We don't want people removed from the connections that they have in their community.
No, that's a
the
great
most
point.
important thing that we can do to help someone reduce their suicidal thoughts is to build connections. And when we take people out of their community, we're taking the chance of breaking connections.
Yeah.
So we want to keep them in the community.
It's a great point. The previous guest, Barry Floyd, that was on, one of the things that came up in that conversation was that we are hardwired for connection
Absolutely.
and attachment, and so ways to preserve and strengthen that is really important. So can people just come to the mobile crisis location?
Yes, they can. We are open from 8 a.m. to 9 p.m. Daily. Unless we are, everyone has had issues with being short-staffed because of COVID. So we have to make sure that we have enough staff in the office, and that means at least 2 in the office to be open. But most days you can come straight to the mobile crisis office, and we will talk with you and have conversation with you and help you decide what's the best course of treatment to help you with your whatever crisis is occurring.
And the location of that is, we'll put the address up on the screen as well, 240 West Tyrone, but it's behind the
Yes.
main center location.
It's at the back door, basically.
And there are signs that direct people to mobile crisis. But that is weekdays, right? Monday
That's
through
weekdays,
Friday.
yes,
Yeah.
Monday through Friday. Because
And-
there's just not enough staff on the weekends to have it actually open. But you can always call. There's always someone there for you to call.
Mm-hmm.
Someone always answers the phone there.
And the idea is that if after talking with someone, if hospitalization is not required and I can remain in the community, that there is a networking to resources or services in the community.
Absolutely. We can oftentimes get same day or next day appointments. There's crisis stabilization units in Knoxville and Crossville that we can refer you to, which is a little different than a hospital in that you have to be seeking treatment and willing to go independently and
Say
able to
something
stay
about
safe
that.
while you're there.
What are crisis stabilization units?
So they are 3-day inpatient type units where you go and you can get see a doctor every day and maybe get mental health meds prescribed if that's what's needed. You have an option to attend some coping skills groups and gain some coping skills. And it's just a place to stay safe and get away from the actual stressors that may be contributing to your crisis. It's completely voluntary. You have to be willing to participate and actually work toward, your goals while you're there. And they will help you get Aftercare set up, what we call Aftercare, which is an appointment with an outpatient community mental health provider, to make sure that you continue on a treatment plan, that can reduce that depression or whatever the case may be, to reduce those suicidal thoughts.
Yeah, no, I think that's good for people to know what. And sometimes they hear CSU.
Yes.
We acronym everything,
Right. And assume that people know what it is and they
Yes.
don't work in the field. So
Yeah.
yes.
So you mentioned emergency departments, but you work closely with law enforcement as
We
well,
do.
right?
Yes, we do. We work closely with law enforcement, and that we may have to go into jails, or they may come and help us out. We don't ever go into the community alone. We're social workers with some, clipboards. We can't manage an individual who might be, agitated or something of that nature. And so for our safety, we always work closely with law enforcement. And especially trained law enforcement, because most of the law enforcement that we work closely with have been trained specifically in a program called CIT.
Yes.
That they've been trained in how to manage crisis situations and how to work more effectively with individuals who are having mental health symptoms.
Yeah, that's we'll have to have an episode specifically on CIT,
Right.
which is Crisis Intervention Team. So,
Yes.
yeah, I'm glad you brought that up. Well, it seems like incredibly difficult and challenging work.
It can be. It can be challenging to always be talking to folks who are in crisis. But we do sometimes have folks stop by who are not in crisis just to say, hi, I'm doing better, thanks, which is great. We love that. We love for people to come by and just say hi to us. Helps us build relationships, and folks get to see that we're not scary people who just lock people away, because that is so not what we do. And we hope to build those relationships with individuals who do struggle with these types of thoughts, because there can be folks who have chronic thoughts, and those may not be something that completely go away. And at times when they're stressed, they may get worse. So it's good that we know them, and we know, when they're not okay.
Yeah. As you mentioned earlier, relationships are important.
Absolutely.
So I'm always curious. I ask this of every guest. So what do you do to take care of yourself?
What do I do? Mm-hmm. Well, just like this weekend, I'm going camping and fishing. I got a boat, and so I'm going out on my boat. I spend time with my family, building those connections, and my friends, my grandkids. I love my grandkids more than, like, that is God's gift for getting through those teenage years with your own children. And so I will have them this weekend, and going camping with some friends and my grandchildren, and that's what I do.
The great outdoors.
Absolutely.
Do you have a favorite
outdoors.
lake that you go to?
I just love water.
Yeah,
my granddaughter and I, you could just give us water, we will be happy.
Yeah.
We love just going everywhere. We like going different places too. We don't want to go the same place every time. And we've done things like camping along a creek in this place that we always go to, but we just inner tube on the creek, and it's not as quick as some of the others that are on the
rapids or
whatever, but they're slow, and it's just fun. And because they're small, I don't want to put them in danger. So
I'm a big fan of the lazy river. So
yes. It's just a lot of fun. We just love being outdoors, and as silly it is, collecting whatever rocks, like things that are shaped funny or just pretty to us, so it creates, a connection between us, and it creates all that memories and fun stuff, and
promotes all those resiliency
Absolutely.
things that everyone needs in more abundance nowadays.
And we have my adult friends who are also going with us, which creates those trusted adults, because kids need trusted adults they can talk to. And, I have to mention ACEs, of course, because ACEs are a huge impact on suicidality. Folks who experience 4 adverse events in their life as children, and those adverse events could be seeing their parent abused or assaulted, a parent going to jail, having a parent with a mental health issue that is out of control. All of those things are called adverse childhood experiences, and that's what an ACE is, an adverse childhood experience. And anyone who has 4 or more of those are like 4 times as likely to have suicidal thoughts, and their possibility of committing suicide or attempting suicide just goes up astronomically, just with 4 incidences. And who of us doesn't have 4 incidences?
heightened risk factor for sure.
Right.
Yeah. Yeah, we'll have to do an episode on ACEs.
Just on ACEs,
Yeah.
absolutely. ACEs is something that we could talk about for hours.
Yeah. Well, I can tell that just seeing you radiate smiles, talking about how you spend time to take care of yourself is clearly important to you. And thank you for
Absolutely.
sharing that. Being outdoors is always a good thing. We've brought it up numerous times throughout our episodes. So, Melissa, thank you so much for coming in. I think it's really important that we get information out to the community about what Mobile Crisis does,
Yes.
put faces to the program.
Yes.
And I think, as you've really highlighted, it's a no wrong door resource for the
Absolutely.
community. So, we certainly encourage folks to use that. Again, it's specific for those 18 years of age and older, and it serves our 5-county service area: Anderson, Campbell, Morgan, Roane, and Scott counties.
Correct.
So,
Correct. And we do have families who call who just need guidance. That's great too. We're willing to talk to just about anyone who calls, just to help you get an idea of what you can do. That's, just call us and we can talk with you and guide you in the direction that you need to go.
Yep. Fantastic. Well, again, thank you for coming in,
Right.
and thank you for tuning in once again. Please take time to subscribe, ring the bell so that you get notified of our latest episode, and we hope you have a great rest of the week. Take care, everyone.